This show is not a substitute for professional counseling, and no relationship is created between the show host or guests and any listener. If you feel you are in need of professional mental health and are a UA student, we encourage you to contact the UA Counseling Center at 348-3863. If you are not a UA student, please contact your respective county's crisis service hotline or their local mental health agency or insurance company. If it is an emergency situation, please call 911 or go to your nearest emergency room.
It's 6 o'clock and time again for Brain Matters, the official radio show of the UA Counseling Center. We are broadcasting from the campus of the University of Alabama. Good evening. My name is Dr. B.J. Gunther, and I'm the host of the show along with my colleague and producer, Catherine Howell. And in case you don't know, this show is about mental and physical health issues that affect college students, and in particular, UA students. So you can listen to us each Tuesday night at 6 p.m. on 90.7 FM, or you can listen online at wvuafm.ua.edu. You can also download the MyTuner radio app and type in WVUA FM 90.7 and find us there. Also, if you have any questions, I always make this announcement every week. If you have any questions or if you have any ideas for upcoming show topics, please email those to us at brainmattersradio@wvuafm.ua.edu, and I'll try to consider those show topics, because we're always needing, I keep a running list, to be honest with you, a running list of show topics that people send me for upcoming future shows. This is our fourth show for the spring semester. We don't do shows in the summer, but we'll start back up in the fall. And I do need some more ideas for this semester for the last few shows. So if you have those, again, it's brainmattersradio@wvuafm.ua.edu. And also, I'll try to remember, Catherine tries to help me remember to give out this email during the show. In case you have any questions or anything comes up about college mental health, you can always email me. Tonight's show topic is one that I've really been wanting to do for a while, and it's just come up on my list that I keep, my running list of show topics. Psychedelic-assisted therapy is fascinating, and I think sometimes when people first hear about this, they're like, whoa, what is this about? But when you start reading and you start doing research, and there's evidence-based research on psychedelic-assisted therapy, so it's legitimate. You understand that this can be a life-saving alternative for some people who nothing else has worked, and we're going to talk about that in depth. Many people are becoming, dissatisfied with traditional treatment methods for everything from PTSD to depression, and they're looking sometimes to psychedelics for help. Evidence suggests that psychedelics can not only treat such conditions, but do so quickly. And this comes as potentially, like I said, life-saving news, especially for those experiencing suicidal thoughts. However, psychedelics are powerful substances. People are curious about psychedelic medicine and therapy, and should do their research before starting any course of treatment. My guest tonight is Kenton Bartlett. Kenton, and I hope I'm pronouncing your name correctly. Kenton is a licensed professional counselor with a private practice in the Birmingham area. He's going to give us a lot more insight about what this is all about, how long he's been doing it, et cetera, et cetera. Thanks for being on the show, Kenton.
Thanks for having me.
Tell the listeners about yourself, a little more about yourself, your credentials, and why you're interested in this topic.
Sure. So I'm a licensed psychedelic therapist, or just licensed therapist, really, and I have formal training in ketamine therapy, MDMA therapy, and also EMDR and brain spotting, which are two kind of like non-talk therapy approaches. And my background is that I worked at an eating disorder clinic for a long time, and then one friend gave me a book on psychedelics, and I read it and was like, wow, this is like really important stuff, because I had never taken any mind-altering substance before only just a couple years ago, and seeing so many people relapse at the clinic, it felt really motivating to me to try to find something different, that could help people who are not responding to traditional therapy.
Right. What about you said you have formal training in ketamine therapy. What does that mean?
So there's a training place called Polaris Insight Center, and it's several people who have a lot of experience in the field of psychedelic therapy, and they got together and they were like, wow, what do we wish we had learned at the start of all this? So they synthesized everything that they had learned, and they created this they have these different modules, and you can take like day-long training modules, and they have about 8 or so of them. And then you can also go do an in-person retreat where you actually experience ketamine yourself in a legal, with a legal prescription with trained therapists. And I thought that was a really great way to see what that's like to, receive what and to experience it firsthand. And so that was really beneficial.
What does psychedelic mean?
So there's a couple different definitions. One means like mind manifesting, and there's a different way of translating it where it could be like soul revealing. And so essentially it's just, it takes the contents of your mind or the deep down, whatever is going on deep down within you, and it can be really clarifying and show you what's there.
How old is this form of therapy?
Well, I mean, so the use of mind-altering, agents and things that can help expand consciousness has been thousands of years old. And then in our modern world, this was coming around like in the around the 50s and 60s, and around that time. And then
that's what I think about when I hear psychedelic. You think of
right.
Yeah.
Yeah, and so they were starting to use that, and like with psychiatrists and therapists and things like that. And then some stuff happened politically where they pulled the plug, and it was really like unethical. It seemed like it was related to the war and different political reasons rather than anything related to science. So they kind of stopped all the research and all of the therapeutic progress at that time. And then that just brought everything to a screeching halt. And so then only, in the around the late 90s is when it just the door cracked open again, and then since then it's been gradually building momentum until now, where I think the momentum is reaching a pretty good pace, where now a lot of people are coming on board with it, and it is starting to become more integrated into our more modern mental health world.
So do you think you said the 1990s is when it really became more integrated in Western clinical settings, would you say?
Well, I think that was like my memory is that was the first like study that was ever allowed to have happen with psychedelics again. So like there was this huge, long gap, and then they just said, well, we'll do one study and allow that to happen. And then since then, more studies have been gradually growing. And then ketamine, I'm not sure exactly when ketamine started to be able to be used in a more therapeutic environment, but I think it's relatively recent, like 2010s or something like that.
Yes.
If I want to say.
I want to say that too, because the show before we started this show, I was telling Kenton that I had a couple of people on. I've had a couple of shows that are probably on. They're probably podcasted to audioboom.com. I don't think they're on Apple. And they were about ketamine therapy, I believe specifically for depression, if I remember correctly. But we've had 2 people on the show in the past talk about just ketamine therapy, what it is. Do you what do you think? I don't know how to ask this. I'm going to do the best I can. What do you think was the cause of it being more accepted?
I think maybe just desperation.
Yeah.
like our world, like just the mental health is not getting any better. People are dying from all kinds of things like addiction, suicide, struggling really hard with PTSD and all kinds of things. And so it's like, okay, well, what we have is not working. Here's this other thing. And so we might as well see if that's going to help.
I know.
And so, I mean, that's what I want to believe is kind of driving this.
It's an alternative, like we've been saying, to traditional medicine when something's not working. I mean, there are lots of alternatives too. We've had a show on TMS, transcranial magnetic stimulation. Sorry, that's a little bit different too, and I'm sure when people hear that, they're like very questioning. But if you've ever had anybody in your family who's been desperate for treatment for whatever the condition is and nothing has seemed to work, you will try just about anything. You will.
Right.
What about what kind of conditions? I mentioned depression, but what kinds of things or disorders, issues, problems, however you want to label it, what are they used for? What are psychedelics used for?
I think they're extremely versatile tools, in our mental health world. I mean, they could be used for things that, diagnoses that we often think about, like PTSD, depression, anxiety, OCD, sleep stuff, just there's so many things. But I like to think of it like a little bit more holistically sometimes, and not even really rely that much on the diagnostic labels sometimes, and sometimes just even using these as a tools for growth or expansion, or to deepening one's relationship with oneself, or even relationship stuff. It could improve people's relationship lives, and so it could be used also for couples and families, and even spirituality wise. People can really grow in all kinds of ways from these things, because they really kind of quiet the noise in your mind sometimes, and allow you to go deeper and access some more kind of like the wisdom that might be lurking sort of somewhere inside.
What conditions do you see the most of that they come to you for help? A lot of times trauma, because trauma can just sort of ripple out into so many other things. Someone could be presenting with symptoms associated with depression, anxiety, or addiction, but when you sort of like really get to the bottom of it, a lot of times that is from trauma, and that sort of just ripples out from that. Yeah, and a lot of time, I think I saw on your website that you're also trained in EMDR.
That's right.
We've had several shows on EMDR, which for listeners who don't know what that is, it's eye movement desensitization reprocessing, I think is what it is. And you have to have credentials in that and training. And I had a therapist who was on the show a few weeks ago. I believe she said, Catherine, correct me if I'm wrong, I believe she said it's the number one treatment now for trauma. So you have both credentials, you have like a couple of things that you can literally use with people who maybe, like I said, normal, traditional, what you think of as therapy, it hasn't worked for them. Mm-hmm. I bet they're relieved. Yeah. I bet they're relieved when they talk to you that there is an option out there for them.
Sure. And I like to, be able to present different options so that they're, if one thing isn't working, okay, well, let's try something different.
That's right. Let's take a short break. And then when we come back, I want you to walk us through like what happens, like how you make the decision with the client to use this form of therapy. Okay. So stay with us. You're listening to Brain Matters on 90.7, The Capstone.
WVUA-FM, Tuscaloosa.
This show is not a substitute for professional counseling, and no relationship is created between the show host or guests and any listener. If you feel you are in need of professional mental health and are a UA student, we encourage you to contact the UA Counseling Center at 348-3863. If you are not a UA student, please contact your respective county's crisis service hotline or their local mental health agency or insurance company. If it is an emergency situation, please call 911 or go to your nearest emergency room.
You're back listening to Brain Matters on 90.7 The Capstone. I'm Dr. BJ Gunther, and we're talking tonight about psychedelics in therapy. And you might be shocked to hear that, but this is really I don't want to say up and coming because it's been around for a while, but it's really being introduced now as an alternative or a treatment for a lot of different conditions. We just got through, before the break, we just got through talking about some of those conditions that people come to Kenton Bartlett, who is my guest tonight. Kenton is a licensed professional counselor in the Birmingham area who does psychedelic-assisted therapy. So I was asking Kenton about, walking us through what's it look like if I call you and explain to you that I need to make an appointment. What's the next step? What happens?
Yeah. So to be honest, the demand for psychedelic therapy has been just monumental. And I've had to continue to adapt and refine to be able to try to meet that demand and not turn anyone away, because I think it's so valuable. And so I keep trying to get creative about how to do that. Yeah. And now, like, I'm so specialized that really anyone who's coming to me is only interested in psychedelics. So it's not a matter. It's generally not a matter of like, are we going to try to do psychedelics or not? For the most part, it's kind of like, which one is the most appropriate for me? Or, I mean, I also do the brain spotting and EMDR, but a lot of times the conversation is about, I'm interested in psychedelics. Which one is the most appropriate for me? And so then we talk about different medications and things like that, and also different legal opportunities. If ketamine isn't a good fit for this person, then we could talk about, either joining a church or clinical trial or going to another state or country in order to, provide harm reduction to make sure they're doing it safely and so that it is helpful for them.
How do you choose what psychedelic to use?
Yeah, there's so many different factors. So like if someone is really afraid of psychedelics, for example, I think ketamine would be a great place to start because it's, and the way I use it is with lozenges. So people get their own prescription of lozenges through a doctor, and then they, would take just a little bit, like one lozenge to see what that's like. And then we wait about 25 minutes and then they can take a boost and then take another boost later if they want to. And it's really short acting. So it's about an hour and a half. And so if they hated it, they'd be back to almost normal in about an hour and a half, and it reduces anxiety a lot. And so I think that would be a really great tool for those reasons, because you're more in control of like the gas and the brakes, and it's a shorter experience versus something like mushrooms is a much longer experience and can also generate a little bit more panic or anxiety. So if someone's really struggling with panic or anxiety, that might not be a good place to start. And being on medications has a lot of, that has a lot to do with it too.
Right.
Ketamine, for example, you could be on almost any medication and use that. Whereas mushrooms, you can be on more things, but if you're on an antidepressant, like anything related to your serotonin system, that can dull the effects. And so then you take the mushrooms, for example, and nothing would really happen. And so those are just some of the factors, but there's many more psychedelics and a lot more factors that we could talk for a long time about all that.
Well, I've read a couple of articles about how long each lasts. You mentioned ketamine is more of short term. I mean, how often would somebody have to be seen if they choose to use the ketamine therapy, as opposed to like mushrooms or MDMA or LSD even? And I know that's shocking for some people who are listening to this, but Kenton's going to explain this to us.
Yeah, so I mean, I think they're all equally beneficial tools, and they're all going to the same place, which is inside of all of us. And so when used with intention and in a really safe and constructive environment, they all have equal potential for equal benefit in some ways. And so like the way when people come to me, I recommend people think about this stuff as a series of like 4 psychedelic journeys. And each one is kind of like a puzzle piece. And if you have just a single puzzle piece, it might not make sense. But if you do one and then you wait, several months and you've integrated the experience, whatever happened, then you do another one. And then you can, wait several months and then do another one, or a year, or however long you want to wait in between. And then that way it's like there's a bit of a themes can start to develop, or, it's like if you don't get everything out of one experience, you might want to try again and go deeper, or you might want to switch to a different psychedelic and see what happens there. And so then if you and you can mix and match for these 4 experiences. So I think that can help people, just leaving it open to where you could, have some flexibility with making sure you do more than one experience to get the results you might be looking for, and also to have the flexibility to switch from one psychedelic to another.
Which one is the most long lasting?
LSD is a really popular one that's long lasting. So that's about 10 to 12 hours. But there's another one. It's a lot more obscure. It's called ibogaine.
Yes.
And it comes from like a root bark in Africa. And it lasts about 24 to 36 hours to go on an experience with that.
Are all of these plant-based?
Not all the psychedelics, but that one is for sure. So
yes.
What
about, are there any, how do I ask this? Do you have a process for choosing which clients are right for this treatment? In other words, I'm assuming not everybody who calls you accept.
I try. I've been doing my absolute best to at least meet with everyone who reaches out to do a consultation,
yes.
If possible. And if I haven't reached out and someone's listening, just let me know. I'll try to get with you.
Sorry.
Yeah. But so I try to meet at least once with everyone. And some people, like after meeting for a consultation, if people might get afraid or be like, I don't really want to do this, but and that's also not appropriate for everyone. So it could be that someone has, just different reasons, like a history with different psychological issues or different medical issues. These are two things that, we would make sure to look at to make sure that everything would be appropriate. Like if there was a lot of heart conditions, for example, that would not really be safe to do. Or if there's an extensive history with psychosis or, out of touch with reality or manic episodes or something.
They wouldn't be appropriate.
Yeah. And it could just depend too. And if someone, like, for example, doesn't have any support whatsoever. So they're not seeing a therapist. Not a lot of friends or social support, and they're wanting to do a really intense psychedelic experience. Like that might not be a very good idea because so much could emerge for that person. And if they don't have people to talk about it with afterwards, that could be, psychologically dangerous. So there's just lots of different factors that, to talk out in that, especially the first consultation appointment.
What about we're talking about there could be possible risk, and we're going to get to that in a minute, but are you connected with any medical facility? I know you don't have medical training yourself, but is that a requirement to be able to administer this?
I work with a couple of different doctors, and the doctors are, have different training in ketamine, and then they offer a prescription. So like when I meet with a client, I recommend that they go to one of those doctors, and then they get the prescription from the doctor. So they're in a client-patient relationship with that doctor, and then they just have their own prescription. Yes. So I never actually touched the ketamine myself at all. And so people just have their own prescription. They're totally responsible with it or for their prescription. And then I'm there to, provide safety and support to do it. And there's actually not a lot of really concrete laws that I know of about how that should be done. Because, for example, like someone has their own prescription, right, and so they can take it at home, or with even a friend could theoretically sit with them while that's happening. And so, but the consequence of that is that the majority of doctors will not prescribe it because most doctors are just not willing to take on that kind of liability. Well,
that was my next question. Is there a high liability to doing this?
Yes. I mean, I think it's extremely safe. Bottom line,
yes.
I mean, I think it's extremely safe, and I'm really meticulous about all kinds of like safety protocols and making sure every client has all the information that they could possibly ever want, maybe even too much information. But even still, there's liability with that. And a lot of insurance companies aren't really comfortable with it, for different reasons. And so, but hopefully in the future, that'll be more commonplace, and it has to start somewhere.
So is it legal? Is it illegal? Is that why the insurance companies are hands off, and that's why some doctors are hands off too, not just the liability? But explain that a little bit.
Yeah, it's not illegal. It's totally legal. So any doctor can write a prescription for ketamine. But the trick is that, it is not FDA approved to treat mental health kinds of things. So It is FDA approved as an anesthetic for surgeries and stuff, but because it's not FDA approved, in theory, a doctor, a worst case scenario could be that a doctor might be worried that, okay, well, I'm prescribing off label, because that's what that's called when you do something that's not FDA approved. Right. And then something happens with the client or something, and the medical board gets all upset with them, and now they're in hot water because of that. And so, but it's a really challenging thing, and there's a lot of, I don't want to get in the weeds of it, but I think there's a lot behind.
No pun intended.
yeah. But I think there's a lot of behind the scenes factors that make it kind of an uphill battle in a way. Like, for example, ketamine is off patent. So that means that no pharmaceutical company can make any profit from it. And so then, therefore, there's not a lot of research to make it FDA approved. And so even though we have seen, in the literature, for example, that it is more effective than Spravato, which is S-ketamine, which is sort of like a different
form. Nasal spray.
Yeah, the nasal spray, it comes in that form. And so then it's ketamine outperformed S-ketamine or Spravato in the clinical trial and that sort of thing. But no one can really make a lot of profit off of that, for example. And so then that one, there's more incentive for a doctor to be able to prescribe that one, which is essentially not as effective than to use the more effective thing, which would then be off label. And so there's just all kinds of tricky elements here, but it's like, I think we have to start somewhere. And I really feel passionate about advocating, even if that requires taking a little bit of risk, because someone has to do it, I guess. If we're going to make a change.
That's my next question. We've talked a little bit about and I'm looking at one of the email questions that we got, and we've already really addressed this. Is there a certain screening process for this type of therapy? You've already answered that. And what are some of the things that would make someone ineligible, if any? And you've kind of touched that a little bit. What are the risks?
With different psychedelics, there'd be different risks. With ketamine, I think the biggest one I would say would be like the psychological destabilization in a way. Like if you take this thing and then you have some big trauma comes up that you've been suppressing or something, and then you have no support, or you're just hit with this wave of grief. It's like maybe there's all this stuff that just comes out, and then now it's hard to function. It's hard to contain that. Or someone could have a total, worldview shifting spiritual or sort of a change in worldview that can happen almost like spontaneously. And then it can be like kind of isolating to where like, wow, no one really gets what just happened to me. And now my family thinks I'm weird or whatever.
Or whatever. Do your clients have to sign some sort of waiver, or would that be contained in like the informed consent, that all of our clients sign? Yeah.
So there's an informed consent that I do for my normal like therapy practice, and I do that with everyone. And there's a general liability waiver that people sign just to be, to engage in private practice at all. And then there's a second informed consent for ketamine therapy that's also followed by a second specific liability waiver for ketamine therapy.
Maybe we need to take another break right now, but I could just keep going. When we come back, though, I want to ask you about taking referrals from other mental health providers, how you do that. So hang on. You're listening to Brain Matters on 90.7 The Capstone.
WVUA-FM, Tuscaloosa.
This show is not a substitute for professional counseling, and no relationship is created between the show host or guests and any listener. If you feel you are in need of professional mental health and are a UA student, we encourage you to contact the UA Counseling Center at 348-3863. If you are not a UA student, please contact your respective county's crisis service hotline or their local mental health agency or insurance company. If it is an emergency situation, please call 911 or go to your nearest emergency room.
You're back listening to Brain Matters on 90.7 The Capstone. I'm BJ Gunther. We're talking tonight about psychedelic-assisted therapy. My guest is licensed professional counselor in private practice in the Birmingham area, Kenton Bartlett. We just finished talking about risk. We've talked about skeptics. We've talked about, who would be appropriate, what kind of conditions psychedelics can treat successfully, the research that's behind this form of therapy. But when I left off, I want to ask you, Kenton, how does another mental health provider send you referrals? What would be what would be the appropriate way to do that?
Yeah, a lot. So I have a waitlist survey on my website, and a lot of times it'll say who did you hear about this from? And a lot of times people will say, my therapist told me to check you out or to do this.
Right.
And then that has actually happened quite a lot. So just from therapists from all over, the people I've never even met or talked to. And so that I think is a great way of doing it, because my services, again, are really specialized. And so I kind of see myself increasingly as kind of like an adjunct service, where it's okay, it would be ideal if you have a primary therapist who you've been working with for a while. You've really, really talked about a lot of things that are going on. And then, we work together in a more of a short-term intensive way, and then use this extra tool to go deeper inside. and then, the primary therapist can be there to, talk about what happened, like sort of like, and what that, if that's related to what's been happening, in the therapy process beforehand. And then also I'm available too for integration sessions as well. Cause sometimes, the ketamine space or, the psychedelic journey can be very specific. And there could be things related to that, a primary therapist might not have experience with, and then I can sort of be there as an additional support.
For people who come to you and they've never used drugs, they've never done anything like that, but they're willing to try because they're desperate. How do you explain to them? Can you explain to them what they might experience?
Good question. Yeah, it's hard to explain exactly how it would feel without doing it. But I have created, like, there's a whole part of my preparation process is to review like something called the flight instructions, which is like how to psychologically prepare for an experience. So it talks about like, if a vision comes up in this way, this is what you can do. Or if you get, freaked out in the middle of it, remember to breathe. And so there's like different tools that I try to make sure people are prepared with before they go into it. But it's hard to explain exactly what the content would be in the experience. I've
gotten an email question. This is what they say. This is how they started. First of all, I am obsessed with the Enchanted Forest Psychedelic Studio Kenton has. What is that?
So I created this space called like the Psychedelic Studio, and it has all these different rooms that are essentially experience rooms. And so they all have totally different vibes. And there's one room called the Enchanted Forest, which it's like the floor is 4 inches of foam. It's covered in plush blankets, and all the walls have like different wallpapers, and it's kind of meant to mimic like being outside, but in a controllable environment where you could do that 9 to 5. And it's like you lie down, you look up, it's like you're under the stars with trees, above you. And so it's meant to be a really comfortable environment that's really conducive to experiencing these things in a really optimal way.
You mentioned at the beginning of the show, you're also trained in brain spotting. What is that?
So it's, I like to think about it like a collaborative meditation experiment in a way. And so the idea is like, how sometimes when we talk, we like look to the side of the room or something.
Uh-huh.
And so like the idea is where you look, it like affects how you feel. It's associated with different memories that you have. So the way this technique would work is, I'd say, hey, what do you want to work on today? And the person says, my deepest trauma, or I got in a fight yesterday. And then we notice that their eyes are going like to the door or something. So then what they do is just look at the door, think about that thing, and then pay attention to any thoughts, memories, emotions, or body sensations that come up. And then just like stuff happens, like a lot of, therapeutic insights will come about, different body sensations will happen. And it can be really surprising and really interesting what happens. And I think it's a really amazing tool because it is, I think, really related to the psychedelic process where you start with one thing. It's like, okay, well, I just got, was road raged at someone on the way here. And then by the end of the session, now I'm like weeping about a lost, my lost relationship or something. And so it can really go to the part of your brain that's like on fire and allow people to process whatever might be kind of below the surface, I guess.
Yeah. Wow. It sounds a little bit like EMDR.
Yeah.
From what I know about EMDR. Mm-hmm.
Yeah, they're very, very similar. I'd say the difference is that EMDR is kind of like, okay, we're gonna work on this specific trauma or this specific belief, okay. And if you deviate too much from this, we're gonna go back to it. We're gonna stay in this box or within these parameters. Whereas brain spotting is like, we're gonna start here with what's upsetting you right now, and we're just gonna see where that goes. And you could go way far, off to the side or something.
Wow. Is there with regards to psychedelic assisted therapy, is there a minimum age that you'll say?
Not really. There's actually some research on like ketamine being used with adolescents, which is pretty cool. And ketamine is even administered in children's hospitals when children have injuries. So it's safe to work with, with people at different ages. But
what's the average? What's the average age you see?
I mean, I don't, yeah, honestly, like a lot of adolescents don't really reach out to me. And so I don't, I don't even have an average age anymore. I don't know. It's kind of a wide range, really,
Really?
like 20s, 30s, 40s, 50s, 60s.
Is
Sometimes
there
even,
a limit to the oldest age? Is it dangerous with elderly?
uh, not that I know of. I mean, the
Okay.
biggest risk would be like a fall risk. So
Yeah.
like that would be really because balance is really hard with ketamine, so that's tricky. And then some of the with another safety note, like for with mushrooms and LSD, there is potential for someone to have like the activation of a gene responsible for like schizophrenia, or it could even
Oh
activate
yeah.
a manic or psychotic episode. And so like if someone is unaware that they might have that predisposition and they take a
Mm.
high dose at a young age or something, that can be
It
pretty
could
dangerous.
trigger it.
Yeah.
Yeah, I hear you. What
People
about gender differences? Do you see more men than women, or vice versa, or is it about equal,
um
or what's your opinion?
I for whatever reason I if there I don't know, maybe I might work with a few more women than men maybe. And I don't know if that's just my personality or what. I don't know. But
Or maybe
is the
women
case.
may be more open to it too,
Yeah, or that. Yeah.
to therapy in general.
Right. Yeah.
Um, what's the difference between using like now I didn't make this question up. I researched this, okay, and you'll know this. What's the difference in between using plant conscious altering plant-based drugs versus chemical compounds?
Yeah, there's different debates on that. Like is it, organic or was it made in the lab or something? And there's different opinions on it.
Right.
I tend to think that they can both be equally profound.
Because
And
you mentioned just a minute ago that it sounds like you do see some people who take like an SSRI possibly, and then can also utilize psychedelic assisted therapy too.
right. Yes. Uh-huh. Yeah. So like ketamine is something that there's some research that it's also found in nature in a way, like I think as a fungus somewhere, like really obscure kind of fungus. But also that it is primarily made in a lab right now. But I think the way I think about it is like maybe the brain could be some sort of like antenna, and these are just different tools to sort of like clue you into different things. But they're all, I mean, they're all just incredible, and they all feel different and have different properties to them. Yeah.
I think you said insurance does not cover this. So how expensive is this form of treatment?
So yeah, like I wasn't sure what insurance was going to do or not do. So I just chose not to fight with them because I imagined it was going to be too
Hard.
bureaucratic and too difficult. And I wanted to focus on just helping people the way that I could. And so I do offer a super bill that people can send if their insurance covers out of network providers. And so that would be a way, that and on the bill, it doesn't even say anything about ketamine at all. It would just say, we're meeting for a session. But the thing that would raise flags potentially with the insurance company is it would say, there's 4 hours of therapy on a single day,
Yeah.
which would be when we would do the ketamine therapy.
Yeah.
And then the insurance, person might be like, what is this? We're not paying for 4 hours
Right,
on
right.
a single day. Are you crazy?
That's outpay. That's like partial day treatment program. Yeah.
Right. So that might be a barrier. I imagine that would probably be a catch for some people. And the cost of it, like essentially, is just it's time with the therapist. And so that's really the most expensive part of it because it's a long experience. But I think that people sometimes can get more out of one ketamine session than many other like different types of therapy, for example.
How do you get around? Is there a way to get around that though?
I mean, like. The therapist could not charge anything, but that would be one way to do it. But I try to like do whatever
Or a
I can.
payment plan?
Oh yeah, that too. Yeah, and but I try to like empower people, hopefully to like, these are the skills that would, be required to be able to engage in really intentional and constructive psychedelic work. And then people could sort of go off from that, and they could do ketamine on their own, in a really constructive way independently, or even use a different psychedelic later on.
What about, I don't know where I saw this. Maybe it was on your website. I can't remember where I saw. There is a multi-site study between Johns Hopkins University, the University of Alabama at Birmingham, and New York University. Do you know about that research?
Yes. So sometimes I talk with the researchers at UAB, and they're just doing all kinds of awesome work. And they've been really focusing on, a lot of their focus has been on like addiction. So, using psychedelics to lower addictions of different things. And so they've been working on smoking cessation. And that's been the first NIH funded study in, I think, 50 years or something. So it's a really big deal. And I think they're just doing it in multiple sites to get more data.
Interesting. Yeah, I was impressed. The UAB, I mean, come on, we know UAB is wonderful, but UAB, Johns Hopkins, and NYU, come on. Those are three big ones right there. People always ask me, like, when I make a recommendation or when I make a referral for medication evaluation, they're always asking about their brain chemistry changing. Like, they're scared of that. Sometimes. Does this alter brain chemistry? That sounds like a dumb question, because you're going to be like, well, duh, yeah, BJ, it does. But you know what I mean? Like, what do you tell people as far as like how it affects somebody's brain chemistry?
There's lots of different factors with that one. And so like it creates more connections in people's brains, and it also alters one of the serotonin, or some of the popular ones alter like different receptors in your brain that are responsible for like learning and unlearning.
Yes.
And in a way, it can kind of be like pouring Miracle-Gro on your brain, where you're like making more connections and things. And so I think the biggest thing that I would prepare people for is like to be ready for change. Like these are tools that can really help people grow, and sometimes rapidly. And so if people aren't ready for any kind of change or perspective shift or, emotional things to come up, maybe it's not the right time. But it's not like a traditional psychiatric medication, because these wear off, like you take them and then the effects wear off short term, but the perspective can stay, or the way that your neurons have kind of like grown together, or different insights, that can be lasting. And so, as long as people are prepared for the changes that might result, I think that's the more important thing, rather than like what's happening with my brain chemistry, which I think would be more important with, taking a psychiatric medication more long term.
Exactly. And I mean, for somebody like me who has training in substance use and substance abuse, chemical dependency, when I first heard about this, it was scary, because for so long, for my career, we teach, or we talk about, or we've seen. I've worked on this college campus for 17 years, and I've seen the effects of abuse of some psychedelics, and so that makes me apprehensive sometimes, and that's why I wanted you to come on the show to explain some of the, the differences. What about people who are concerned about addiction with the psychedelic drugs? How do can you prevent that? I know it's not, it's being monitored, it sounds, and regulated, it sounds like.
Yeah, I'm wondering how long I have to answer that question. I just want to make sure with the
we're good.
We're good. Okay, great. So with addiction, so anything, people can develop an addiction to literally anything at all. There's that show, My Strange Addiction. Yeah. And so the bigger risk would be developing like a psychological or emotional attachment, rather than the physical addiction of it, And so like with mushrooms, psilocybin mushrooms, there's like no evidence whatsoever of any kind of chemical addiction. And then there's marginally, more addictive potential with LSD, I'd say marginally more. And then above that, I would say ketamine has marginally more addictive potential, and then MDMA has more than that. So I would, if I just off the cuff maybe would say that. Yeah. But when approached like we're doing, like, and a big part of my job is to like really encourage people to take this extremely seriously. And it's all about, like, okay, we're going to, journal about this and really clarify what your intention is, and imagine that you are going to like a super legit teacher, and that's how you should approach the experience.
Right.
And then afterwards, a lot of discipline to follow through with whatever might have come about in that experience. And so when putting those things in place, it just allows, I think, to bring that addiction potential close to nothing, because people are taking it really seriously and are approaching it as a really important experience.
Right. It's not recreational. This is not recreational. This is
there can be playful elements to it, so it's not like we want to take it so seriously that but I don't see it as like a let's go out and party or something. It's like, no, this is
I got my ketamine, let's go. I get it.
Right.
Well, let's take our last break, and then when we come back, I want to ask you about resources, if you have any resources for people who are interested in listening. So hang on. You're listening to Brain Matters on 90.7 The Capstone.
WVUA-FM, Tuscaloosa.
This show is not a substitute for professional counseling, and no relationship is created between the show host or guest and any listener. If you feel you are in need of professional mental health and are a UA student, we encourage you to contact the UA Counseling Center at 348-3863. If you are not a UA student, please contact your respective county's crisis service hotline or their local mental health agency or insurance company. If it is an emergency situation, please call 911 or go to your nearest emergency room.
Listening to Brain Matters on 90.7 The Capstone. I'm Dr. BJ Gunther. We're talking tonight about psychedelic-assisted therapy. My guest is Kenton Bartlett. He is in private practice in the Birmingham area and a licensed professional counselor. And Kenton, are you the only therapist in the state who's doing this? How many are there in Alabama?
No, there's a few others. So there's some there are different levels of training, and so. I think there's two others who are have completed the training and are available to do it. One of them works in several different states and is licensed and works mostly with OCD. Another one who's finished their and they don't live in Alabama, but they do offer that service. One is in our state, Fancy Sears. She's completed a lot of training, and there's several other therapists. Alex Baugh and Peggy Hobbs are working on completing their training. And I just posted on my Facebook a list of other people who are offering integration services at different levels of training and experience and things like that.
What are some resources for listeners? Books, podcasts, websites, anything you can think of?
Yeah, great question. So if you go on my website, KentonBartlettCounseling.com, and you scroll down, there's like a lecture that I gave, like a talk speaking thing that I tried to condense as much information about psychedelics as possible. And I think if you go on that YouTube page and you scroll into the comments on the YouTube thing, there's a list of resources, and I put all kinds of books and podcasts and all kinds of stuff. And then I'm really current on Facebook. Which you just type in my name or Kenton Bartlett Counseling into Facebook, and I post things on there all the time.
Thank you so much. This has been so informative. I've really enjoyed this. This is fascinating to me. I mean, we could have probably gone another hour, but it goes by, like I told you before the show, it goes by pretty quickly when you're like asking questions and answering. It's just fascinating. Have you ever presented at the Alabama Counseling Association?
I have not. Well, not formally. Through school, I did. I had a poster there.
Just curious, because I think this would be a very innovative, creative, interesting topic for presentation at the annual conference in November.
Oh, for sure.
Just heads up. Thanks so much again. I appreciate it.
Thank you.
I announce this every week, but our shows are recorded and podcasted on Apple Podcasts. I mentioned audioboom.com. There's a lot of shows. I think we only started posting on Apple a couple of years ago during COVID, and then the rest of our shows are on audioboom.com, but also on voices.ua.edu. You can just type in Brain Matters and you'll find some of our past shows. There's also a link to voices.ua.edu on the Counseling Center's website, and that's at counseling.ua.edu. I always like to thank the people who've made this show possible. To begin with, our Executive Director of the Counseling Center, Dr. Greg Vanderwall, Terry Siggers from the Office of Student Media, and of course my production assistant and colleague, Catherine Howell, my colleagues here at the Counseling Center, the WVUA staff who edits our shows every week, and my guest tonight, Kenton Bartlett. Next week, we're going to run a rerun, and I'm not sure what that's going to be. That's going to be on Valentine's Day. And then our next show, I think, will be February the 21st on how to heal from depression, if that's correct. Catherine, is that right? How to heal from depression. So we're going to talk a little more in detail about depression and treatment. So we appreciate you listening. Join us in a couple of weeks. Join us actually next week for our next show. It'll be on Valentine's. So hopefully everybody will be in a good mood that night. But thanks for listening and have a good evening. Good night.
This show is not intended as a substitute for professional counseling. Further, the views, opinions, and conclusions expressed by the show hosts or their guests are their own and not necessarily those of the University of Alabama, its officers, or trustees. Any views, opinions, or conclusions shared on the show do not create a relationship between the host or any guest and any listener, and such a relationship should never be inferred. If you feel you are in need of professional mental health and are a UA student, please contact the UA Counseling Center at 348-3863. If you are not a UA student, please contact your respective county's crisis service hotline or their local mental health agency or insurance company.